So I'm going to explain murmurs. Between S1 and S2 it's systolic murmur, and between S2 and next S1 is diastolic murmur. So let's understand the blood flow because it is very important to understand murmurs. Uh, in left ventricle, blood comes in from right atrium, and the valve in between them is tricuspid valve. So blood is coming in through tricuspid valve in right ventricle and through mitral valve in left ventricle. And blood is going out from right ventricle via pulmonary valve, and from left ventricle it's going out from aortic valve. As we can see here, atrioventricular valve I already shown you here, mitral and tricuspid. And blood comes in through arterioventricular valve. In semilunar valve, which is aortic and pulmonary, from here blood goes out. And during systole, as we all know, ventricular contraction happens, due to which blood will go out. And during diastole, or which is ventricular relaxation, blood comes in. So blood comes in during diastole and blood goes out during systole. So systolic murmur, which is between S1 and S2, means murmurs which is heard between S1 and S2 sound. So during systole, there will be ventricular contraction and blood will go out from pulmonary and aortic valve. So first is mid-systolic or rejection murmur. So mid-systolic or rejection murmur is due to obstruction, and the causes are aortic stenosis, pulmonary stenosis, HCM, and ASD. All these are obstructive causes of mid-systolic or mid-systolic murmur, which is also known as ejection murmur. Now the second cause, first one was obstruction cause, second is the leaks back. So if there is any regurgitation or hole in the valve, then it can lead to holosystolic or pansystolic murmur, like mitral regurgitation and tricuspid regurgitation and VSD. As we can see, if there is issue in blood going outside due to obstruction, then that is AS or PS, aortic stenosis, pulmonary stenosis. And if the blood is leaking out, because blood is going out, so aortic and pulmonary valves are open, but mitral and tricuspid are closed, but still blood is leaking. There is a regurgitation of the blood from these two valves, and which leads into systolic murmur, which is holosystolic murmur or pansystolic murmur. Now let's go to the diastolic murmur. So diastolic murmur will occur between S2 to next S1. In this case, blood is coming inside, and blood is coming inside from where? From mitral valve and tricuspid valve. So it is of three types. Like first is the early diastole, where blood leaks. So blood will leak from where? Which valve is closed? So blood will leak from the valve which is closed here. So here tricuspid and mitral is open because blood is coming in. So closed valve is aortic and pulmonary. So from there regurgitation is happening. So that's why AR and PR, aortic regurgitation and pulmonary regurgitation. Then second is the blood struggle to come in. Like first one is the leaking cause, as we already saw in systolic also, and here we are seeing in diastolic also. Second is the blood is having problem in coming in, so that is why it is happening, because of AV stenosis. AV stenosis, which is ventricular valve stenosis, which can be mitral or tricuspid stenosis, so MS or TS. And these two are actually mid diastolic or late diastolic, Both are both murmurs can be seen in MS and TS. Now, if I show you a better picture of diastolic murmur, so see the S2 and S1. Between them, there is three phases: early diastole, mid diastole, late diastole. These are actually murmurs: early diastolic murmur, mid diastolic murmur, late diastolic murmur. But late diastolic murmur occurs only if there is sinus rhythm is present. So what is sinus rhythm? Means it is very close to S1. Late diastolic is obviously very close to S1, so it is just before the S1. And it happens only if the atrial contraction is present, because this murmur is seen heard only when atrial contraction is present. Means S1 is normal, only when it will happen, or we can't hear the late diastolic murmur. So, in the question, if there is written like mid diastolic murmur plus sinus rhythm or presystolic accentuation, then only we can say that it's late diastolic murmur. And by default, if there are four options, you have to choose MS, that is mitral stenosis, because if these two things are given in a question, my mid diastolic murmur and sinus rhythm or presystolic accentuation, then always mark MS. TS can also be marked, but there should be a sign of right side heart failure, or any information regarding JVP or inspiration, or anything which shows that ascites or hepatomegaly, also anything which shows that there is right side heart failure or anything, then only mark tricuspid stenosis. Otherwise, always, if there is mid diastolic murmur and sinus rhythm or anything, then you just mark MS, means mitral stenosis. That's all about the murmur actually.